We come to you from the Rela Hospital in Chennai, and private hospitals have started vaccinating people free of cost. And to talk to us about that, Dr. Ilan Kumran, the CEO here. Doctor, thank you very much for your time. How does it look like as you start the free vaccination now?
Thank you for coming in. As of today, if you look at the state of Tamil Nadu, the government has vaccinated more than 2.1 crore public until now. Recently, the government of Tamil Nadu has launched a new scheme. It's kind of a public-private partnership where Tamil Nadu is expecting the many private players to participate in vaccination program so that the number of vaccination will be improved. Until now, the private players, especially the private hospitals, were charging the patients, and government of Tamil Nadu was providing the vaccination at free of cost. In this new partnership, not only the hospitals, many of the private companies will be through the CSR funding will be donating money to vaccinate more public. Hospitals have also contributed. In the last few days, number of hospitals in Tamil Nadu has contributed in donating more money through CSR to vaccinate more people. For example, at Rela Institute, we have donated 10 lakh rupees to vaccinate more than 1,000 people in the next few days actually. So I think that will dramatically increase the number of people vaccinated. Still, it's a long way to go because if you look at the number of vaccination required for the state of Tamil Nadu, it will be 12 crore.
Right.
As of today, we have crossed 2 crore. Still, we have to complete 10 more crores. I think these kind of initiatives, which is first in Tamil Nadu, will really help to boost the number of vaccination very soon.
How has been the response on day one?
Response is pretty good actually. We are getting a lot of queries and a lot of walk-ins asking for free vaccination. I'm sure the response will be pretty good over the period of time because the government may not be able to support everybody in the state. I think if you look at the number of private players in this health industry, it's more than 80% of the hospitals can participate actually. I'm sure the response will be pretty good, and this is a very good initiative from the government of Tamil Nadu.
Is it also as a result of less patronage by private hospitals over the last few months? Although you were eligible for 25% vaccines, only 5% were administered.
Yeah, that's true. But at the same time, the number of vaccines available to the hospitals were also pretty low. You had to look into one more thing. Until a month ago, smaller nursing homes were not able to get vaccination at the adequate quantity. I think with these new schemes where the local community, even the private companies can donate and then partner with the local hospitals and then promote the scheme actually. I think pretty sure this will be a successful.
And you will still have the paid service also available parallelly.
Yes, that's a plan. So what we are planning from our center is we are going to participate with many NGOs to go and reach a specific population and start giving free vaccination. And we are going to continue this paid vaccination also because a lot of corporates can afford paid vaccination for their employees. We are going to run both parallelly actually.
And have corporates got in touch with you expressing their interest to tie up?
At this point of time, we have been tying up with many corporates, even many of the big companies, MNC companies are tying up with us. So we even go to their campus to vaccinate their employees actually.
And do you think this is a model worth replicating across the country to increase vaccination as private hospitals haven't been utilizing fully their quota of vaccines?
I strongly believe, I think this is a fantastic initiative. Actually, we have to find out more and more innovative ideas over the period of time where we should be able to populate the whole country in the next 6 months of time. I think this is a good initiative. I'm sure there will be multiple other options available where even we can adopt that model.
Right. Thank you so much, Doctor, for your time. That was Dr. Ilan Kumran from the Rela Hospital talking to us in Chennai with Suresh, Sam Daniel, for NDTV.